Greetings to all judges. I'm YEE KEE and I would like to present my research with the title Risk and Protective Factors of Trauma and Suicide Potential Among University Students. First of all, I would like to give a brief information about suicide and trauma. The Malaysia's age standardized suicide rate in 2019 was reported to be 5.77 per 100,000 population, with approximately 5 suicide deaths per day. And according to the WHO World Mental Health Surveys conducted among 70,000 respondents from 24 countries, revealed that 70.4% of them experienced at least one type of traumatic events across their lifetime, indicating that having a trauma history is common in the community. With regards to the problem statement, suicide is the fourth leading cause of death globally among individuals in the 15 to 29-year-old age bracket, indicating that university students are one of the vulnerable groups to suicide. Additionally, there is also a knowledge gap on the association between trauma and suicide potential among the university students in the local context. The research objective is to determine the risk and protective factors associated with suicide potential among trauma-exposed university students. The risk factors are psychic, depression, and parents' marital harmony, while protective factors are social support, self-esteem, and religiosity. This was a cross-sectional survey research with data collected in one public and one private university in Malaysia using convenient sampling method. The sample size was calculated using the rule of thumb by Green in 1991, with a minimum samples of 99 was required, and the inclusion criteria were university students aged 18 to 30 and English literate, while exclusion criteria was refused to provide informed consent. The instrumentation include demographic data that collects information about the nationality, age, gender, religion, and parents' marital harmony, while the psychic scale by Holden et al. 2001 was used to measure the psychological pain of an individual, and next, patient health questionnaire by Kroenke et al. 2001 was used to evaluate the presence of depression within an individual, and third, multi-dimensional scale of perceived social support by Zeman et al. 1988 was used to measure the perceived social support on 3 dimensions, which are family, friends, and significant other. The instrumentation also include the Rosenberg Self-Esteem Scale 1965, which was used to measure the global self-esteem, and the Revised Intrinsic-Extrinsic Religiosity Scale by Gorsuch and McPherson 1989, which was used to measure intrinsic and extrinsic religious orientation, and lastly, the Trauma and Suicide Potential Index developed by Osman et al. 2012, which was used to assess an individual's desire to attempt suicide due to experiencing a trauma. The procedures of the study begins with the ethics approval from the institution, and later, the students were approached by the researcher and they were briefed by the researcher about the aims and procedures of the study. Written informed consent was obtained from the students prior to answering the pen and paper questionnaire. With regards to the data analysis, all analyses were conducted using the SPSS version 25, including the descriptive statistics and inferential statistics. The alpha level for statistical significance was set at 0.05. In terms of the results, after deleting the missing data listwise and removing the outliers, the total number of participants is 215 with mean age 19.01, standard deviation 1.34, and most of the participants are female and Malaysian. Most of them were Buddhist, and their parents' marital were harmonious. The results of the multiple linear regression showed that the predictors accounted for 15.6% of the variance in trauma and suicide potential. Higher trauma and suicide potential was associated with higher psychic, lower social support, and lower intrinsic religiosity. In this study, psychic is a significant risk factor of trauma and suicide potential, consistent with past research. Besides, inability to manage psychic could also lead to suicide. When the psychic persists and becomes intolerable, it limits the body's awareness and the signals interpret the body as a lifeless object and perceive it easier to attack. When psychic is associated with the inability to express the stress and unavailability of support, the risk of engaging in more lethal suicidal behaviors increases. Hence, our study findings also supported that social support is a protective factor of trauma and suicide potential in line with past research, He et al. 2019. Social support allows the trauma-exposed individuals to habituate to the memories related to the traumatic experiences through trauma-related discussions. Additionally, intrinsic religiosity is also protective against trauma and suicide potential, consistent with the study by Liu et al. 2018. Individuals who are intrinsically religious incline towards forgiveness and perceive trauma as a loss rather than a violation of entitlement towards others or God, which is associated with less distress and more post-traumatic growth. In conclusion, based on the findings of the study, future interventions can focus on the management of psychic, improve their perception of social support, and encourage the practice of intrinsic religiosity among the university students. The limitations of the study include causal relationships between the variables cannot be established, and there is also a lack of diversity on the participants' demographic backgrounds. During the pandemic, the suicide cases in Malaysia showed an increment, with an average of 3 suicide cases per day between January and May 2021, compared to the year between 2014 and 2018 at 0.93 suicide cases per day. The COVID-19 pandemic could be a trauma due to the loss of roles and self resulting from the economic uncertainties, and therefore the future research are recommended to examine the suicide potential among the university students at the endemic phase to allow comparisons. These are the references. That's the end of my presentation. Thank you.